urethra. See the urethra right there? See the two ureters here from the two kidneys? See them? What's that area of the bladder called right there?
The neck?
Where these, yeah, if you look in your book, there's a nice little picture of, with a bladder that's been opened up, and you can see where the actual openings are for the ureter, but on the inside, and you know, it's labeled as trigon. Okay. So, the urethra, of course, goes this way, outflow tract for urine, and its opening, the urethral orifice, is inside this space right in here called the vestibule. So the external genitalia here would be vulva, and you have to go in just past the vulva internally. Before you get to the vagina, there's a connecting space between the vulva and the vagina, and that's where the vestibule is. That's what it's called. And that's where this comes to an end. And the female domestic animal species that, you know, that include the cat. So pelvic canal right here, floor of the pelvis, the bone is right there. So we're going to try to go in and cut that without. Let's see. Nice sound, huh? Now that sharp bone right there, I probably should have like a file so you guys won't hurt yourselves. So I can smooth that off some. You know, that bone, pelvis. Okay, still kind of sharp right there. So you see more of the urethra now? Right there. And where is the uterus in relationship to the bladder? Above or underneath it?
Right now it's behind it.
Well, this is dorsal to the bladder. So the bladder is ventral to the uterus. I think it's the same in, isn't this why when, you know, during a pregnancy, there's a lot of weight on the bladder?
Bladder issues, yeah.
Yeah, and the bladder doesn't hold very much urine, and so like, you know. Okay, I have 3 kids, so. I didn't get pregnant though. I wasn't the one who actually, you know, had to endure all of this misery. I guess it's kind of miserable sometimes, huh?
Yes.
It wasn't that bad?
It wasn't that bad.
Really?
Mine was.
Okay.
Mine was not.
So, so I just wanted to point that out. See, here's the body of the uterus right here, and look where it is, dorsal to this position right here where the urethra is and some of the bladder. All right, so I don't want to cut those ureters, so we'll. So you have some dissection scissors right here. Okay. Thank you. So what we're just doing here is just see the body of the uterus, and where is the cervix? So it's at the junction there. I can feel it. It's kind of thickened. It's pretty far back there. This is all uterine body and then uterine horns, and it's at the junction of the vagina and the uterus, the cervix. Let's see, this is going to work. Okay, we're just trying to expose the reproductive tract more. There it is, the uterus. By the way, be sure that you see the uterine artery on this side. There's another one on that side, on the other side. Those have to, of course, be ligated when you're removing the uterus. And the ovaries, ovarian artery, the ovarian vessels. Sometimes you mass ligate this broad ligament because there's some little arteries in there, little vessels that can bleed. So I always do that, or used to when I used to do surgery. All right. So I'm breaking down the broad ligament, and I'm just going to palpate the cervix. It's just right there. It feels kind of hard and thick. I'm pushing it up. It's right there. And if you put your finger there and feel that, it feels real kind of soft and fleshy on both sides of the cervix, just kind of hard right there where the cervix is. Okay? Now, see it? I flipped it over. You can kind of tell it's right there. I don't know if I have any luck actually opening it up where you can. This is a really. Okay, so the uterus is open. The cervix area is right here, and then that makes this vault right here, this space right there, what? You go beyond the cervix, now we're out of the uterus and we're into the vagina, right? And if you follow the course of the urethra all the way where it attaches right here, this is the end of the urethra, that space there is the floor of the vestibule, which is just kind of like really sort of like the entrance to the vagina. Just a little space between the vulva. You guys, it's pretty interesting. If you know, when you talk about trying to pass a speculum or a catheter or anything like that, but if you're trying to actually get all the way to the cervix so you can look at it, but you know, we'll just wait and talk about that more later when we cover reproductive system, which we will hopefully get into that some before the end of the semester. All right, that's all for now.